system, fact versus fiction, honesty versus deceit. These ethical battles have been at the forefront in the fight against COVID-19.
Public health measures require a degree of truthfulness to be effective, and while some people act in accordance, others do not.
So why do some follow guidelines while others fib? CTV's Heidi Petracek takes a closer look into truth, lies, and the pandemic for us right now. Heidi?
Maria and Jason, it's not hard to find misinformation about the virus online, and we have heard of cases in which individuals have lied about their close contacts or travel. But the question of why it happens doesn't have a simple answer.
By not disclosing, they're putting people's lives at risk.
It's a topic maritime officials have addressed in recent days.
Some have lied to public health.
New Brunswick's premier calling out those caught lying to contact tracers. Recognition that fighting the pandemic requires a degree of honesty from citizens. There's just one problem.
People lie all the time.
And this psychologist says most of us do at least once or twice a day. Some lies are small, others more serious, and some people lie more than others.
Some people lie about everything, even things of great importance like where you were in a pandemic.
There is quite a degree of concealment and secrecy going on about our COVID behaviors.
Researchers at Brock University studied more than 450 American adults last year. They found 1/3 of those with COVID-19 denied having symptoms. A quarter reported lying about physical distancing. O'Connor says the reason comes down to consequences.
If you're breaking some of the protocols or rules, and then you don't want to be shamed from other people for doing that, you're embarrassed about your actions, that can encourage you to want to keep that information secret to protect yourself.
So as a community, the more we establish that, this is just what we do together, I think that creates also a lot of sort of positive feedback.
That's why this bioethicist says public health officials encourage following protocols to protect others rather than emphasizing punitive measures. But she says the need for honesty goes both ways, a point recently made when a number of Canadian politicians went abroad despite official directives to the contrary.
One of the reasons that we've had so many ethical questions come up is because the pandemic illustrates just how interconnected we all are.
It's a tiny fraction of death.
Then there's misinformation, another type of dishonesty in which inaccuracies spread far and wide as swiftly as technology will allow.
The greatest example of that is the HIV/AIDS epidemic.
Pandemic historian Jonathan Roberts has a whole podcast series covering everything from the Black Plague to yellow fever. Roberts says the pattern repeats itself.
But the problem is, as soon as you enforce, there's always going to be a group of people who think that the disease has been created or invented to control. And as soon as you assert that control, they're going to say, aha, see, I told you so.
A pattern from the past that can be used to learn during the present pandemic. So what can be done to combat dishonesty and misinformation? Well, the experts I spoke with today have a few thoughts on that. One is that education and encouragement is better than punishment when it comes to public health protocols, and that open and transparent communication is key to keeping everyone on the same ethical page. Maria and Jason.
Makes sense.